welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Maria Peach. She is a general practitioner in Rarotonga, which is an island in the South Pacific. She is joining us. It is 5 o'clock in the morning now for her. So thank you so much for joining me. We'll talk about her Kevin MD article. Let's talk about bullying in medicine. Maria, thank you so much for joining me.
Kia ora, Kevin. Thank you for having me on your podcast. It's really nice to be here.
We'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
Yeah, so I currently work as a general practitioner on the island of Rarotonga. Our country is made of 15 islands, and Rarotonga is one of them. We are northeast of New Zealand on the map and west of Tahiti, if you have a look there. I'm indigenous to these islands. My mother's from here, and I spent most of my time growing up in Aotearoa in New Zealand and some time in Australia. But I returned here in December of 2020 just to sort of come back and be back here and work in our community back in the islands. I just have a background in public health and also in some climate change work, advocacy, and work as a general physician at the moment at a practice on the island, done some emergency medicine, and also have a background in mental health.
So tell us about what a typical day is like for you practicing on the island and some of the typical cases that you may see.
Yeah, I've just recently shifted from working from the ministry, which was a combination of working in the outpatient unit and emergency medicine. So we have an outpatient unit on the island situated in the community, and then we also have the emergency department, which is situated up at the hospital. So that was a mix of cases of, general practice type cases, working alongside, your flus, your comorbidities, NCD clinics, and then also the emergency situations where you have things, people coming in with acute pulmonary edema, MIs, and so forth. And at the current practice that I'm in, we're mainly focused on working with the general practice type presentations, and do get the odd emergency that we do refer up to the hospital if they do turn up to the clinic. Yeah.
So what are some of the biggest challenges and rewards that you have practicing medicine?
I guess the biggest challenge would be the limited number of workforce carrying the load at present. That's a big, big challenge. And I think it's not just here. I think it's all around the world at the moment. I'm not sure about America and Canada, but I do know, in Aotearoa, the number of trainees that we put through the system to come out and work in the system is not as much as there are in other countries around in the world. Yeah. So the yearly intake at med school in Aotearoa is roughly 200 a year. So, with the COVID pandemic, with everything that was happening, there's a massive demand on the usage of, resources in the health system, and that happened here as well. When we opened up the doors to the wider community, the international community. So yeah, it's managing resources and staff and having the staff, available to be able to implement healthcare and deliver. The reward of seeing people get better, feel better, and feel happy with, the way that we've all looked after everyone. So that's really, really neat. And one of the things I did notice here, we get fed a lot by the people that we look after, the patients, the community. They often bring in a lot of food to say thank you.
So let's talk about your Kevin MD article. It's titled, "Let's Talk About Bullying in Medicine." Now, for those who didn't get a chance to read your article, just walk my audience through it and share the story of why you decided to write it.
It was an accumulation, I think, over many years of being in the field. And, a lot of us are going through a real reflective time right now. We're looking at our past, we're looking at, different decisions that we've made. And I had to look back, and I've been working in medicine for 12 years. And I realized a lot of the decisions that I made and career choices and pathways that I'd chosen were influenced largely by a lot of the experiences that I had, and also some of the experiences that my colleagues had. I see, workplace horizontal violence, workplace bullying as a massive issue in medicine that does need to be addressed, because There's different reasons, yes. I mean, like there's different implications for this type of behavior in the field. One is the obvious, the effects of the health and well-being of the workers themselves. Our health force, they're being devalued, demoralized, and that obviously has impacts on the way in which we then deliver the quality of care we give, but then also our relationships with people we go home to and our relationships with our colleagues. That's kind of like the obvious impact. But one of the impacts I think is really important is the impact on the actual workforce and obviously the people that we care for long-term and longitudinally, because we're starting to see people leaving the workforce because of the different behaviors. And if we're getting people leaving the workforce, then we don't have a staff or a workforce to deliver healthcare. Ultimately, there's a massive long-term complication of that. I know in Aotearoa, the population pyramid, if you're looking from a population health perspective, the population pyramid is going to flip, in the next 20 or 30 years. So you're going to have a massive population to care for in the elderly, later on. And one of the things I'd been thinking about in the last week was Generation Z. Now, I'm a Generation Xer, and so I'm quite an admiration of the way that they challenge things. And I think actually this is going to be a spanner in the works when it comes to health, because they've looked at the way that we've all approached our work-life balance, and Generation Z's come along and said, yeah, no, I'm not quite keen to work that way. And I think it's good for medicine. It's going to challenge medicine, because you're going to have, unless you have a healthy environment, unless you have an environment that people want to work in, how are you going to retain staff, and how are you going to draw people into the field, unless the environment itself is conducive to working? And I think this is really important long term as well.
So paint us a picture, give us a story or an example of some of the bullying that either you've experienced or that you've seen in medicine.
Yeah, there's been a few, different scenarios. I mean, there've been times when I've, been, I guess, humiliated and for the way that I've implemented some cares. And there's that it's more insidious, I think, these days than what it used to be back in the older days of medicine. I mean, you can get massive work emails sent out with not just yourself, but about 300 other people. I mean, that's an exaggeration, but 20 or 40 other people. And whereas the practice doesn't specifically name you, but that you were the clinician on that day and so forth. And so it's quite an insidious way of demoralizing someone and the way that they are at work. And in actual fact, it's really, really interesting though. I find that a lot of the people that, and not just myself, but my colleagues, were actually quite studious and committed in our jobs, and actually still quite knowledgeable in our jobs as well, but not necessarily vocal about that knowledge, and not necessarily upfront and saying, this is what I know, and and that. And I find it's a lot of those people who are actually at the brunt end of that. And I'm not quite sure the whole reasoning behind that, but I find it's a lot of my colleagues and myself and people that aren't as vocal in the workspace, that just like to come and do the job they have to do and make sure that they do it well, are more inclined to experience a lot of horizontal workplace bullying.
So do you find that most of the bullying, does it come from fellow clinicians? Does it come from patients? Does it come from administrators? Where in general does most of this bullying come from?
I think it's actually multi-sourced. One of the things I noticed is that when you go into this field, you go in very values-based, well, most of us do, go in very values-based, ideals, sort of based. You want to relieve suffering, and you want to relieve pain, and you want to help heal. And then you go into a system that's very limited in the way that healthcare is implemented. So it's limited in budgets, limited in rosters, it's limited in resourcing staff. And then you've also got the people in different positions that have completely different ideas, expectations of what they expect to be delivered in healthcare. You've got your CEOs, your managers, the people that allocate funding and so forth. You've got your colleagues, your seniors, you've got the people that you work alongside. Then you've got the patients as well that we have to deliver care to. So everyone has different expectations of what they want from yourself or your colleagues as healthcare physicians. So I think when you have that mismatch, a bit of a different mismatch, you're going to get practices and structures that want to maintain those bullying behaviors, if that makes sense. So it's kind of like, for example, I mean, let's face it, we're in a system that is about input, outputs, productivity, and profit, and that's in our countries. And I can't speak for other countries around the world, but I can say, in the countries that I've worked in, that's what it's about. So it doesn't matter how it's packaged. At the end of the day, I think that's those kinds of systems maintain different, bullying behaviors, because it's of benefit to the system that workers, are sort of pitted against each other in some ways to maintain structure, to maintain hierarchy, to maintain profit. And so I think we really have to be mindful of that when we ask where the sources come from. I think it comes from anyone that's devalued, actually, whether they are your colleagues or whether it is someone higher up on the chain, or when you're talking way up the top in management and so forth, or anyone that's devalued is going to feel like a sense of a need or a desire to protect their work. I don't know what the right word for it is, but they're going to they will feel this need to protect themselves, or anyone that feels threatened. So it's not necessarily just a hierarchical thing. It can be a sort of on the same level as you. It can be different professions against different professions. If that particular profession does not feel valued, or those particular workers don't feel valued, it is the perfect breeding ground for bullying behavior.
We're talking to Maria Peach. She is a general practitioner in the South Pacific island of Rarotonga. Her KevinMD article is titled, "Let's Talk About Bullying in Medicine." So Maria, if a clinician is in a position of unfortunately being bullied, what kind of recommendations do you have for that clinician to respond to it? Or what kind of advice do you have for that?
It's one of those situations where, because you're working in a work environment, it might seem quite restrictive in how you can approach it. And that's where I think we need to have more solution-based sort of groups, or little sort of groups within organizations and ministries and so forth, to be able to deal with it. Because when you're isolated, it's quite it's challenging. It's really, really challenging, because you can't necessarily go and chat to somebody about issues, because they're more or less in the same position that you are in, and there's that fear of speaking out, and people losing their jobs, and then those in the positions of power exerting that power again on those that are more vulnerable. So if you're in a position where you are being sort of bullied and hassled, it does help to find one or two people that you can trust, whether they are within the field or in the building or in the clinic, the space that you're working in, or whether it's external and you're chatting to someone externally, because you do need to be able to share your concerns with someone, at the time. But I also recommend documentation. So documenting the experiences that, because hierarchy or management, or people will consider it or subjective and in your perspective, right? But it is nonetheless your own experience, or your experiences of your colleagues. So documentation is really important, that you catalog all the things that you've gone through from the very first time, or you may have to go back and look back. Is documentation is really important, because you might be able to flesh out what triggered that experience, people that have witnessed it at the same time, because there will be people around you that have witnessed the way that you've been treated. And it's all really important, and it all adds up.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
It's an issue that's really important for the obvious reasons in terms of worker health and well-being, but long-term for the health system itself, it is really important that we deal with this, because without a workforce, if people are leaving and they're doing different things, and then you lose a workforce, and we need a workforce to be able to deliver healthcare. Ultimately, the most important thing is that we address these issues, whether we do it collectively in little groups and within organizations, via unions, some kind of support network. But that, those issues do need to be addressed, because, otherwise we're going to lose people that have been trained for a long period of time, right? And then all of a sudden they're no longer around.
Maria, thank you so much for sharing your story, time, and insight. Thanks again for being on the show.
Thank you so much.